Hi everyone. This video is going to walk you through the protocol for an aorta ultrasound. First, we're going to start with the anatomy of the aorta. As you see, there are a lot of branches to the aorta and it can get kind of confusing, so hopefully this video will help you with that. So first, the aorta comes off of the left ventricle of the heart, goes into the aortic arch. As it continues throughout the thoracic cavity, it's then going to be known as the abdominal aorta when it passes the diaphragm, as we see in the image. Notice that the first branch off of the abdominal aorta is known as the celiac trunk or celiac axis or celiac artery. It has three different names, so just be aware of all three. The second branch is going to be the superior mesenteric artery, also known as the SMA. From there, we have the renal gondola, inferior mesenteric artery, and common iliac arteries, which is the bifurcation of the aorta itself. Now, we're not really going to see the gonadal artery or the inferior mesenteric artery, but it's still good to know where it is in case we do need to look for it or happen to see a vessel in that area. Okay, so now that we've gone over the branches, we're going to get into the protocol images. So here we see the proximal aorta in a sagittal plane. We see a liver that is anterior, also superior to the aorta, as well as spine in the posterior aspect. Notice we do not see the celiac trunk branched off, but that is a-okay. Sometimes it's not possible in every patient. Okay, now we're going to move on to the sag mid aorta. We still see part of the liver here. Notice it's not as much. We also see a branch of the SMA coming off the aorta. That is going to be our sign to measure the mid aorta, which is we want to measure inferior to the SMA. Now we're going to move on to the distal aorta. Notice we're going to see the bifurcation of the aorta here, where we see the left and right common iliac arteries. Notice there is no organs visualized. It's mainly just bowel in this area. So if you see the liver or the pancreas, that means you're too superior on the patient, and you're not going to be able to get that distal area. Also, it's good to know that for distal aorta, you're going to be just a little bit or around superior to the umbilicus on the patient. Okay, so we have gotten all of our sagittal images of the aorta. Now we're going to move on to transverse. This image right here is a transverse proximal aorta. Notice that you see the liver just anterior to the aorta. This is going to be your sign to tell you this is proximal aorta. You should always have the liver in this image. You're also going to have some artifacts of shadowing lateral to the aorta just because of the bowel and the stomach there. Okay, so now that we have finished the transverse prox aorta, we're going to move on to the mid. Notice the mid, it's going to be in the same area as we measured in the sagittal plane. So we're going to see our SMA. We're also going to see probably a piece of the pancreas, maybe a teeny piece of the liver, but predominantly we're going to see the splenic vein that courses posterior to the pancreas there. And then in between the SMA and the aorta, we are going to see the left renal vein. If we're lucky, this isn't possible in every patient, but that's okay. I'm sure you all guessed it. We are moving on to the transverse distal aorta. Again, notice there is no organs around this portion of the aorta because it is mainly consumed around bowel. So that is why we're not going to really have much of a landmark. After transverse distal aorta, we're going to move on to the bifurcation. If you scan just slightly inferior to the distal aorta, you're going to see that one vessel split into two, and that's going to tell us that we are at the bifurcation of the aorta to see the left and right common iliac arteries. Some protocols may have sag distal IVC in it, so we are going to go over that. So for distal IVC, it's going to be in the same area as the proximal aorta, but remember that veins originate more distal in the body. So when I say distal IVC, I'm mainly referring to the proximal aorta area. So since we're going to be in the proximal aorta area, we're going to be slightly little bit to the patient's right because the aorta runs along the patient's a little bit to the left side than the right. We're also going to see the liver and the caudate lobe. We are also going to see a good way to know that we are looking at the IVC and not the aorta is with respirations of the patient. Um, you will start to notice that the walls start to close in on the vessel and then expand with the patient's breathing, okay? Also, the IVC is going to dump into the right atrium just to bring blood back to the lungs to get oxygen and be carried out through the aorta. When we are taking the sagittal measurements of the aorta, we want to be sure that we are measuring it correctly. So, when the vessel is slanted on the screen like so, we're going to make sure that we are measuring 90 degrees or perpendicular to that aorta vessel wall. Notice the red measurements there. Those measurements are inaccurate because they are not 90 degrees with the vessel wall and they are not measuring it on the outside of the wall. So, with aorta or any kind of arteries that we are measuring, we're measuring from outer to outer wall to make sure that we do not have an aneurysm whatsoever. All right, I believe that concludes the abdominal aorta protocol with ultrasound.